Hello, everyone, and welcome. My name is Gary Parker. My pronouns are he, him. I serve as the Associate Dean for External Affairs at the Brown School at Washington University in St. Louis, where I also have the great privilege of serving as the inaugural director of the Clark Fox Policy Institute. And welcome to Open Classroom. To connect with our community across the globe, the Brown School has created Open Classroom, which is a series of free 1-hour webinars on a wide range of topics, from social work to public health to social policy topics. We've had over 200,000 students, educators, practitioners in the fields of social work and public health and public policy, as well as interested members of the global community that have attended an Open Classroom webinar, either live right here on Zoom. We're also live streaming on YouTube, or by watching our online library of recorded programs. So although your cameras and microphones are turned off and disabled, we do want to hear from you. So please take full advantage of the chat feature. Send us your questions, your comments, even if there are links to resources that you would think would be helpful. The other attendees will be able to have access to that information in the chat as well. So please feel free to let your voices out. And we'll also be having an opportunity to have our panelists answer the questions that you submit later in the program. And we do have an exceptional program for you today. But starting us off, I want to invite Dr. Michael Lindsay, who is Dean and Paulette Goddard Professor of Social Work at the Silver School of Social Work in New York University, kick us off. So welcome, Michael, all the way from New York City.
Thank you so much, Gary, and greetings. It's my pleasure to bring you greetings as president of the American Academy of Social Work and Social Welfare. I want to welcome you all to this latest discussion in the Academy's 21st Century Agenda Policy Briefing Series, Transforming Systems, How Early Childhood Education Can Support Child Welfare and Well-Being. This policy forum is part of an important collaboration between the Academy and foundations that are committed to improving outcomes for youth through advancing collaborative research methods. It offers a unique opportunity for social work researchers and community partners to come together to advance policy for early childhood education. Today, we will hear from distinguished leaders, scholars, about how early childhood education can have a positive impact on child welfare and well-being. Among the people I would like to thank for today's discussion are the Academy's immediate past president, Dr. Mary McKay, for her continued stewardship of this policy forum series, as well as Dr. Gary Parker and Stephanie Anderson from the Clark Fox Policy Institute at the Brown School at Washington University in St. Louis. I also want to thank Nicholas Asher and Sanjam Dutt for their help in organizing the event. Finally, I would like to thank the Annie E. Casey Foundation, Casey Family Programs, Clark Fox Policy Institute, Congressional Research Institute for Social Work and Policy, and the William T. Grant Foundation for their continued support of this policy forum. With that, I will hand things over to our moderator for today, Dr. Parker, who, as you've heard, is the Associate Dean for External Affairs and Director, the inaugural Director of the Clark Fox Policy Institute at the Brown School at Washington University in St. Louis. Thank you.
Thank you, Michael. And what few people may not know is that I served as your deputy director at the McSilver Institute for Poverty Policy and Research. So reunited, and it feels so good, as they say. Thank you so much for joining us this morning and for your leadership with the American Academy of Social Work and Social Welfare. I appreciate you so much.
Thank you, Gary.
Next, I'd like to hand it over to Peter Pecora, who's Managing Director of Research Services at Casey Family Programs. And if that isn't enough, he's also a professor of social work at the University of Washington. Welcome, Peter, and thank you for all of your support and guidance through this programming as well.
Appreciate it. And again, thank you, Drs. Parker, Lindsay, and Anderson for the welcome today. I'm going to make this hopefully pretty brief, but just to set a context for what is this collaboration of foundations that folks are referring to here. And what it is coming out of is, since about May of 2019, a diverse group of researchers, DEI experts, people with lived experience with the child welfare system, and policy experts have worked together to identify research gaps to enhance the development of a 21st century approach to child and family well-being, trying to rejuvenate and transform our child welfare system in the United States. And what began as a partnership between the Casey Family Programs, the Annie E. Casey Foundation, and the William T. Grant Foundation now has evolved into a wider coalition of academic, national, and philanthropic organizations, bolstered by extensive participation from day one by individuals with life experience in child welfare. We believe that new studies in the field should address the most critical issues facing the field, so that the research findings can be used to support innovative policy, program, and practice, as well as changes in how funding streams are designed. And currently, the Research Agenda Coalition is encouraging federal, state, and local foundations to address the 23 high-priority research gaps. And we're actively trying to promote conversations about those gaps in these various sectors. The topic areas also include helping the research community see study participants as partners in the research effort. As part of our prioritizing, our commitment to social justice, this is an important theme of the work we're doing. We believe that stakeholder involvement will really help researchers focus on the most critical issues, especially if that activity is funded adequately. So the researchers and their colleagues have the time and the resources really necessary to do that. We think that participation by community leaders and people with lived expertise in the development of the research study lays the important groundwork for a very good, sound study. And to that end, some cultural experts and people with lived expertise in our team have just produced an equity assessment tool to help enhance program planning and research study design. And I will put the link to the research initiatives, the National Research Agendas, a website where that tool and other products are there for folks to use, up in the chat in a minute here. The point here is that we want a collaborative research approach that can really help ensure that the research meets the needs of not only the researchers, but the children, families, communities, and the provider organizations that are involved. So in essence, we're trying to not only promote the fact that there are some crucial research gaps that need to be addressed, and this August panel that you'll hear from today are going to, I know, eloquently speak to a very important and at times really not getting the attention it needs when we really talk about social determinants of health and really some of the fundamental things that all families need across America. So I'm particularly grateful for them, and we'll be listening to the webinar today. And so I'll leave it with that, but I really did want to thank everybody for helping to organize this, and I'll turn this back over to the organizers and the panel themselves. Thank you, everyone.
Thank you so much, Peter. Really appreciate all that you're doing behind the scenes and for your comments today. And you are absolutely right. We have an incredible panel ahead of us. And I'll tell you what I find so wonderful about this panel is that it is really taking kind of an ecological perspective, because we have a researcher, we have a government policy and program provider, we have a direct service, an early childhood provider, all engaging in the same conversation on how we can support child welfare and child well-being. So we'll be hearing from Judge Darrell Missey, who has decades of experience as a family and juvenile court judge, and now is a leader in state child welfare systems, both in the state of Missouri and now in the state of Florida. We have Catherine Magnuson, who's the director of the Institute of Research on Poverty at the University of Wisconsin-Madison School of Social Work, and is a researcher focused on the well-being and development of economically disadvantaged children and their families. And we have Alicia Lanier, who is the founding executive director of the Urban Sprouts Child Development Center. And she also serves on the steering committee of the Gateway Early Childhood Alliance that is reimagining St. Louis's early childhood system. But most importantly, she was named the very first ever scholar in residence at the Clark Fox Policy Institute. And I'm always so overjoyed anytime I get an opportunity to be around her and hear from her. And we are going to hear from all of us. I want to kick us off first. I'd love to hear from Judge Missey. Darrell, can you tell us from your perspective and in your experience as a judge and as someone that's been engaged in state child welfare systems, what are some of the common misconceptions about poverty and how they may be misinterpreted as neglect within the child welfare system?
Well, I think that's a broad cultural question that we really have, right? How are people judging family crisis? And I think some of it, in Missouri, we talk about our definition of neglect, our legal definition of neglect, which is so broad you could drive a truck through it. It is basically when you do the statutory sort of dissection of that, basically it's the failure to provide anything that is necessary or proper for a child's well-being. Well, we've all done that if we think about it. So what ends up happening is people all have a very subjective set of judgments about what is neglect and what is just a bad family circumstance. And there's nothing in that statute, and there's nothing in our culture or mindset that says that there needs to be some sort of state of mind, some mens rea of the person who's committing it. So in other states, in Texas, for example, they've added, no, you had to have intended not to provide for your child, and it can't be just because you couldn't. In Missouri, it doesn't say that. It just says it's not good. And so, but nobody in 19 years on the bench, nobody ever cited that statute to me. But I think they lived it. It was one of those things that people would think that this family's in deep trouble. They must have done something wrong. I think there's a lot of judgment that goes into it. And so, if we're looking at it from a helping standpoint and saying this is a family in crisis, how do we help them? How do they think we can help them is a different thing from me showing up and judging them and saying, wow, you're evicted, wow, your house is dirty, man, you're struggling with a mental illness or an addiction. We're going to judge you for it and punish you for it in essence, and break up your family. So that and really whether or not that's the approach is different from county to county, different from community to community, as to whether it all has to do with the mindset of the people who are encountering the families.
Right. And I've heard you speak about this before, Darrell, and that oftentimes the impacts of poverty on a family are somehow perceived as neglect or mistreatment, when in fact it could be just that their clothes are dirty because the washing machine is broken. It's as simple as that. It is not actual neglect.
That's absolutely right. Well, and if neglect is defined properly, I think if neglect is defined as your child is suffering because you don't care and you had the ability to do something and you did not do it, that's different from your washing machine broke, your water got turned off. It's different from the things that are poverty. I mean, the difficulty that a child is going through may be identical with regard to poverty or neglect. But I think we need to. I think we need to both, as legally. I think somebody needs to fix that statute, and in practice, we need to understand that most of the things we dealt with, most of the things that wound up with kids coming into foster care, which I was fighting desperately to try to avoid it being as frequent as it was because it's so painful, all had to do with poverty and addiction and mental illness, and none of that is neglect, unless you just didn't care. And I think, us changing our mindset to a helping state frame of reference makes all the difference with regard to whether or not we're going to neglect is you've abandoned your children and you walk away. And poverty is you're trying to get by and you're not making it.
Yeah, that is so helpful. I want to turn to Catherine now. Can you tell me what gaps in research do you think need to be addressed to better understand this relationship between early childhood and child welfare, and what areas should we be focusing our research moving forward?
I think one of the most important, and I see myself frozen for a second, one of the most important and practical areas are what are the types of supports and resources that our social systems can provide to families that will really help them. So I'm going to take the perspective of the early childhood educators out there and say, early childhood education programs and caregivers see children every day, or at least every week if they're coming, weekly. And they see the needs that families have. They see families show up without enough diapers. They see moms that look like they haven't had enough food. And, many of these programs do what they can to support these families. So they have a stash of diapers. They have a diaper bank nearby that they can send parents to. They know where the food banks are. But we have a very fragmented system. And when you have a young child that you're trying to take care of, it is very hard to tackle all the things that you would have to do to meet all of those needs that Darrell was just talking about. And so I think a lot of the work and research to be done is what are the practical strategies, frankly, the evaluating programs that really seek to bring together resources and support parents so that they can find ways to provide for their children and find those both emergency services when someone's facing eviction, but then also those ongoing supports that are really going to help them create a sustainable family life, which they want and they want for their children. So, I think some of the big, at this point, I feel like the big research questions, what do children need to thrive? What do families need to thrive? Aren't so much as a big science question as a detailed implementation question. What are the resources we can marshal, and how can we get families the resources they need in a way that doesn't put the burden so much on them as they're trying to get through their daily lives and take care of their families. So I think more innovation across service sectors and systems, help, training. I know, at least in the early care workforce, there's a tremendous problem with turnover and burnout. It's been a really hard few years, as it has been always for child welfare workers. But I think building services and systems that respond to families as they show up is really challenging. And that sort of cross-system building and implementation is where the research needs to go. We know what kids and families need. It's not a big scientific research question. What we are less certain about how to do is what's the best way to get them the services and supports that they need in the moment that they need it in a way that they can make use of it. So
yeah, that is really insightful and helpful. And Alicia, as a early childhood provider, what have been your experiences with families involved in the child welfare system, and have these experiences informed your approach to the way that you serve those families?
Well, so thank you, Gary. And I was just listening to Judge Missey and Catherine. I mean, we're all kind of saying the same things, but I think, true to the early childhood sector, early childhood space is a safe space for families to be vulnerable, for families to come with what they have and what they're capable of, and for us to hold them, right? I think one of the things that I see throughout many childcare programs are those resources that we can point families to, but it's that gap in like who's calling and reporting, and then who's, championing you for just getting up and bringing your child to school, right? And so if we're all leaning into this strengths-based approach, then we could probably get somewhere in this system. I think that there's challenges for the folks in the system of like, how do I get out of this hamster wheel and prove that I'm worthy enough? And then the folks that are caring for children while they're in the system, it's very complex to try to find a spot, especially when a child is taken in at a very young age, and say you have a newborn that you're taking in, and then, the foster mom has to go to work, dad, and they need places for their children to go. And so they're faced with how do they then put this child who's been taken out of care of their parents into a quality facility that has space, right? And so at Urban Sprouts, we've created some of those emergency slots, but that's not the typical privilege of the other childcare providers, because they need to fill their seats. and make sure that they're full so that they can create sustainability to decrease that turnover that Catherine is talking about. So I think that system coordination, talking to each other about what are the true needs for the families entering and exiting the child welfare system, and how do we keep that number down, Judge Missy? That's what I'd like to see, right? How do we start seeing families as capable? Have, you know, when they walk through the doors, okay, you got your child here. They may not have on shoes today, but we got shoes, we got clothes, and then we're sticking together. How do we set goals? How do we stick close with the family's mental health, their economic well-being, and getting them out of poverty? Taking families from striving to thriving is important. And ECE is really a great place for that, because we can look holistically at what the family wants to do for their lifetime, right? And sort of change that trajectory of the entire family, not just the child.
That's a really interesting point, Alicia, is that often when folks think about early childhood care and education, they think about all of the benefits to the child that is a part of those programs, but they don't really fully comprehend the benefits that happen to the entire family. Can you talk a little bit more about that?
Yeah, I mean, absolutely. I mean, we have families that, you know, might be facing incarceration, or we have families who are, you know, going from, you know, food stamps and SNAP benefits and wanting to enter the workforce, but there's a cliff, right? So if I make too much, I no longer qualify for child care assistance. So finding a job that fits that family's skill level, and getting, you know, being able to afford childcare after they get the job, there's that gap, right? So working with the family on looking at their finances and knowing that cliff, being, you know, a part of how do they go from renting to owning homes? How do they own their own destiny and come out of poverty, I think is essential. So offering, you know, resources like medical care here on campus, so that, you know, mom and dad don't have to take off and take the child to the doctor. We can do that, right? We can get all the immunizations done. We can get the children's teeth clean while you stay at work, because families that have to take off work lose their jobs. And really working on how do we build that family up from 0 to 5. I got 5 years. That's a long time. We can give you care for your child, some collard greens and cornbread, some good economic, some good economic tools, some good mental health services, and a village, because I think that's important too. What keeps our child abuse number down is that there are accountable people in this child's life that they have to face every day. And so when things get challenging, that parent has a relationship and has someone that they can go to in the classrooms, or come to one of the folks in leadership to say, I'm going through this, and we can help them work through those challenges so that they're not alone.
Yeah.
If I can jump in for just a second, I think a lot of what Alicia just talked about was something that federally and in policy, we really tried to bring forward with Head Start programming, right? So it started back in the 60s as a family-centered approach that did much more than just serve children, but really took a whole family approach, and thinking about support services for parents and the whole family. And, you know, after a couple of dozen years of that, we brought in early Head Start to really hit those 0 to 3 years. And most recently, we've expanded it to something called the Head Start and Child Care Partnerships, which are really trying to work with child care, primarily child care and child education providers, to really bring in that holistic service perspective. And so that's been a really important, still want to grow the program, but been a really important avenue to broaden the way in which programs can do family support. Because as Alicia said, most child care and early education providers are actually small businesses. This is not a marketplace that's full of, you know, a big institution. And so you're working with people who have devoted their lives to children at marginal, you know, wages, because they care about their communities and those children. And so the idea that they are single-handedly going to be able to pick up themselves and make up for the lack of support and resources that are in our communities and help families, I think is just not realistic. So I think we need, to her point, we need a real community approach, because these people are doing the good work. But there are also small businesses that are trying to get by, and they really need additional resources, whether it's through the Head Start Child Care Partnership grants or other avenues that will enable them to do more and be able to better support and serve families or refer them as needed. It's a tough, it's a hard job, and you know, these are some of the most important community heroes when they serve families, but they also need our support in their ability to do that.
Yeah, you're absolutely right. And you're making a really fundamental point here, which is that the providers often have to interface with governmental child welfare systems. And that's really where the big challenge is. Darrell, can you talk about some of the challenges that you faced when trying to promote collaboration between the child welfare system and service providers during your time in leadership?
I think what you're up against are decades of mismessaging, decades of you know, we're not here to help anybody, we're here to watch everybody. We're here to tell on you, as opposed to, you know, I listened to Alicia talk about her approach to this, right? You listen to that, and what you see is that somebody who goes to Urban Sprouts becomes part of their social capital. You know, it becomes part of their you know, set of tools to make it through life and to be okay. And in other spaces, people have been trained, it's been in their head, you know, you report things, you call the hotline, you hotline. And the fact is that, you know, the number of hotlines is enormous, and the number of findings of abuse is very small. And what it means is that we've got to find a way to change everybody's mind, to say, if there is something that can be done to help a family who is struggling, that's what we should do, rather than to call an investigatory organization. That's what Children's Division was. That's what our organization was. We investigated things rather than to call them, and so that then they look and see their lives as being something that's being monitored, that it's very accusatory. It's not the approach to that. So it's decades of mindset, Gary. I think that we struggle against, and we worked hard. I think to change that, we were working on the mindset of our folks, working on the mindset of folks in the community. When you run into people like Alicia, it's easy, because she's like, she gets it, she understands it, she's ready to go. And then there are people like, you're telling us not to see something and say something. You're telling us not to ignore all this. No, it's a matter of being wise and saying, you know, is this parent? And again, it's knowing in your head what's neglect and what's just a hard time. And you know, if a parent is bringing a child to Urban Sprouts and asking for help, they're not neglectful. They're doing what they can and should for their child. You know, and I think changing that mindset's a big deal. And I think both in Missouri, I'll tell you what, I just went to a meeting here in Florida, and there are people who get it. I mean, there are people who get it. They understand that, you know, if we are really in helping work, we've got to be open and willing to help rather than accuse. And I think that's the biggest challenge we faced.
Yeah, it seemed, yeah, go ahead, jump in, Catherine.
I was going to say, I agree, but I want to push back a little bit and say it's not only mindset, it's also resources, right? So if you're a child care provider and you know that a mother needs mental health services, but you're trying to run a small business and take care of 20 kids in one classroom, right? You need more than just a mindset change. You also need help in figuring out how to do it, and resources that would give you the time and expertise to be able to do it. And so I just, you know, I feel strongly that the workforce generally wants to do the right thing, but doesn't always have the support and resources it needs to be able to do it. And that's not to say that mindset isn't a part of it, because I agree that is. And I think part of it is leveraging resources to help make that mindset change by having the right sorts of trainings and education. But also, you know, we need to do better at actually just creating the services that families need, and making sure that that people know where they are and can access them in a way that would really support families and programs who are trying to help them.
Yeah, I think the mindset, and correct me if I'm wrong, Darrell, the mindset is not so much with the providers, but by the general public that are calling in all of these neglect calls that are not actually neglect.
And
that's right. That's right. And people being told you have to call if you see something that's a problem. And I think I absolutely agree with what Catherine's saying, that there are a lot of well-intentioned people who call that hotline who think this is my way to get this family help.
Right.
And it is not your way to get a family help. It's a way to get them investigated. My sister, my little sister, she does social work for the Salvation Army down in Jefferson County. She has some great, interesting stories. And she's told me that multiple times people have hidden the fact that they have children when they come to her for help, because they don't, which would have gotten them more help. But she's afraid because, you know what, you're going to get me hotline. And that's part of the reason why we're at Children's Division. We obtained prevention workers, people who were designated to try to get out in front of these cases and actually help prevent children from entering the system, prevent things from happening that cause folks to feel that children should enter the system, and placing them in places like schools and hospitals and early childhood centers, and places where the hotlines might begin, or the difficult circumstances might be observed first. And instead of taking an investigatory approach to this, taking a helpful approach and sitting down with folks and saying, what do you need? How can we help you? And it doesn't divert everybody, because there are some people need to be reported, and there's some things that need to go, there's some things that need to happen, but it's a fraction of what actually goes through the system. So my hope is that, Catherine, you're absolutely right, that we will get people of those prevention workers. I wanted them to become experts on what actually existed in that community that could help these folks. And if those resources did not exist in that community, how can we get that community together to try to ramp them up? If there's, like, for example, if we need just mental health services we don't have, how do we get them? And approaching it that way, and approaching it earlier, so that kids don't suffer maltreatment.
Alicia, I'd love to hear from you too on this.
I was waiting because there's always something good. I mean, I do really believe that we have to, I agree with Judge Missey here, in that we have to have a mindset shift. We can't be afraid to call it out. I mean, we literally are as a community of ECE folks, all you hear is, I'm a mandated reporter. Well, I've always told myself, and I've told my staff, who we report to is our choice, right? So we have to start with, if they've got emergency contacts, it shouldn't be a fire that we're reporting. Hey, grandma, I just saw mom drop off. She smells like she's been drinking. I need your support, right? And it's that we use those emergency contacts and those folks in that village to keep the end in mind. The goal is that the family stays together, right? And so I think oftentimes we utilize the most rigorous thing, which is to hotline folks. We've never hotlined anyone because we have that trust building relationship. So I will go back to kind of what we were talking about, Gary, before this webinar, in terms of like training and what do providers need. I think providers need to know and to think through who is a trusting partner with that family, and like how can we get them connected to trusting people, because what the abuse continues when people have to hide, right? When they're hiding their children, kind of like what you said, when they are doing things that we don't know about, and then the child comes to school and says all these things, and we confront them head on, right? We talk with parents about discipline and parent-teacher conferences and home visits. And even though a lot of these things are in place for like Head Start and early Head Start, those folks are covered. It's that middle income that we need to really be concerned about. Those folks that are going to work stressed out, don't have those Head Start supports, and people who are really trying to make it happen for their family every day and miss the mark because of the still. I mean, in our country, Head Start and early Head Start, you can be a family of two and cannot make over $30,000. That's poverty, right? So people are still in poverty if they're in Head Start. And so our goal is for them to leave here out of Head Start. Like, so if you enter an early Head Start, we're thinking about, girl, where are you going to school? How can we get you a job? I mean, we've walked people from like full degrees and getting jobs and owning homes and changing their livelihood, because it really does matter. And I just think that a lot of childcare providers are, like you said, their job is heavy, and they need supports in knowing that there's someone to call other than the state.
Yeah. The next question I really want to ask for all of our panelists, like what is your vision for improving the relationship between child care providers and child welfare system? Like what changes would you like to see in the coming years? And Catherine, do you want to start us off?
I don't want to start us off, but I will. Sorry. You know what I was, as you were asking this, what I was thinking of is, and again, I strongly identify with my childcare providers that I know and have worked with. You know, I feel like at times not all, but many of our country's problems and hopes and dreams are put on early childhood education, that it's almost held up as a silver bullet to fix everything. And you know, it is a wildly under-resourced, underpaid, challenging job. And so, you know, and I don't hear it this way, but I also don't want to hear that we should use early childhood to fix the child welfare system, right? Like, what do I think we need to do? I think these are two systems that are under-resourced and you know, haven't built a cross-system collaboration. And I think that's a critically important place to start. But I think both systems have inherent challenges of their own that also need to be worked on simultaneously. I mean, it costs somewhere around, I can tell, Alicia, by the way, you're talking about your services, you're probably spending 25, 30,000 on a kid when, you know, I know that's not what you're charging. I know that's not what you're charging, but you know, the services and the intensity and the quality costs money. And ultimately parents can't pay it. And we don't yet have a government system that wants to pay it. And so most kids are in moderate to low quality care, and not getting, you know, as much of a thriving environment as they could. So let me circle back to your question. You know, I think a first part is to have these systems really talk to each other at both a micro and a macro level. You know, so you can, when I put on my systems hats, you can start to think about saved slots, right? That child welfare has in high quality centers that they can call and leverage. You can talk about cross-system training, and a whole bunch of things. But I fundamentally want both systems themselves to take a hard look at themselves, see what they can do, and also be willing to work across it, because it's hard for me, I'm just being honest, it's hard for me to put another requirement, another level of responsibility on early care and education workers when they're struggling just to keep their doors open at this moment in time. And I know how hard the work of child welfare system people are. So I'm less familiar because it's not my deep area of knowledge, but I think both systems have been, you know, under a scarcity mindset and have been scrambling so hard for so many years just to do their basic, you know, work, that both need sort of both need a lot of leeway and support and reimagining and re-resourcing. So that was not a very clear answer, but
that was a beautifully clear answer, Catherine.
No, I mean, I look at the early care and education workforce, and they, you know, in the state of Wisconsin, we're about to have all of the COVID support money go away. And people are looking at wage cuts. I mean, people are looking at going from $16 an hour back down to $14 an hour as a lead teacher in a classroom. Right. And so I don't know how to fix that. Yeah. Sorry, I'll stop there. Look, my esteemed colleagues have more insightful answers about how to get the systems to work together.
So Alicia, did you want to jump in and then we'll circle around to Judge Missey?
I love your passion around not putting so much on ECE. The thing is, it's there. Right. And so I think because it's there, it's a prime time to coordinate around it. And I think we're already doing all of it with no compensation and no additional resources. And I think that, you know, we recently engaged with like someone, you know, an organization in the county to work on mental health coordination for our children. Right. So it's partnering with those agencies to get the work accomplished. And how do institutions like ours, the Gateway Early Childhood Alliance, and other organizations that are sort of systems work organizations coordinate to ensure that early childhood providers have the resources? Because that work is not going to go away. It actually lives there and it's breathing and it's heavy. And so to care for a family and not have the support, to me, is more scary than us not taking it on. And I really understand the breadth of what you're saying, but it's all living there. I think that as a country, I love what you said, that like we've got to get our stuff together in a lot of areas, right? Pay medical leave and all of these things would kind of bring some of that down, right? We see a lot of parents with postpartum and a lot of folks not getting enough time to fully recover before they have to go back into the workforce, and just a lot of things that lead to trauma. And so I think that if we start looking at the ECE system more holistically and not just the care aspect, to your point, we as a country could go a lot further, especially because I just got back from a country who's like prioritizing their children at birth, right? And then I come back and I'm like, wow, we've got so much further to go. But I am encouraged that policy and again the two sectors working together early and often could alleviate some of the system and fractures that we're seeing.
Yeah, so Darrell, from someone that's worked in state government and kind of trying to maneuver through these systems that are not easily shifted, like what are your priorities in terms of supporting kids who are involved in the child welfare system and the service providers who engage with them?
Well, I think as a person who's been in government for this long, and having really tried to do good things, right? I can tell you that it is beyond our capacity. It is beyond the capacity of what's been given to this state agencies or to the courts. Yeah. When I was in the courts, it's like I was ordering kids into foster care because what else could I do? I had nothing else, right? And so I think Catherine's absolutely right. We can't say, okay, we're going to have all these early childhood educators just take care of all these problems because they can't do it. And then they call a hotline and we can't do it. But here's what my hope is that if we tear down our silos and we stop saying, okay, whose job is this? Is that your job? Is that the Department of Mental Health? Is this child welfare? Is that juvenile justice? Whose job is this? And instead ask the question, the people in front of us, what do they need and how can we help them? And not just we the agency, or you, the early childhood educators, or the courts, or anybody else, who we as a community, as a society, can help them. What we have to do that is we got to know who each other are. We got to know what all the resources are in a community. If we don't have them, we got to create them. So I think you're looking at my agency working with organizations like Elise's, working with academia and people who are involved in sort of the policy part of this thing, looking at the faith community, looking at charitable organizations, looking at corporate America and the charitable work that they do, and coming all together and saying, okay, as opposed to trying to figure out whose job this problem is, it's all of our job. And by the way, it includes that family. It includes the family we're talking about, because their greatest resource is them. The biggest expert on their life is them. And I heard somebody describe define wraparound. We always talk about wraparound services and what's wrapping around. That's really the person who talked about this, said that wraparound isn't a set of services, it's a process that begins with that family and finds out what do they have in their toolbox and how can we supplement their toolbox. And then we're working collaboratively to help folks in a way that maybe they don't run away from us, and we can make a difference in the lives and the lives of their children.
Yeah, and thank you to Darrell for acknowledging the expertise that the families can bring with their lived experience. This is not supposed to be a top-down approach into like fixing folks, but this is about empowering and emboldening folks to be able to, not just survive, but thrive, as Alicia said at the top of our program. Now I'm going to start taking questions from the chat, and thank you to Nicholas, who has been pulling them together. Here's one that says, for system coordination, how would it work to move resource allocation and decision-making to community-based organizations that have the local know-how and the trust of the families? Okay. Good folks here asking great questions.
Well, I think the first thing there is that we've got to ask ourselves the question, how do we initiate helping somebody? And so if you're going to initiate help, if you think you're going to initiate helping somebody by calling our hotline, what's going to happen is it goes to a central thing in Jefferson City and it all comes down the hill, right? I think when you're sitting in Alicia's spot and you're saying, okay, I've got this mom has shown up smelling like alcohol. Okay, I know who grandma is. I know the organization down the street who can help her. I know what, I know the things that are local that I can plug them into. And when people feel like they're equipped and empowered to engage with those things without fear that they've done something wrong, by failing to report that they're mandated supporters before they're mandated reporters. That's the term that's going around now. I think when we can do that, it'll everything will be more local because we're looking around at the most of the resources we have are local.
Yeah. I hate to boil it down to human connection, but we have to be better humans. I just, that story was real. I have put parents in an Uber and taken children, home instead of hotlining them. That is a real scenario. And there are lots of more of those, right? Because we don't just get to come in here and wave a magic wand. And it is difficult work. I think I see in the chat someone's asking about, a social worker. Yeah, that's a part of our strategic plan, but it's this is the work, kind of what Catherine was talking about. This is on the backs of ECE folks every day. And we don't have a formalized social worker, but that's like a goal of ours. But we've done what we know to do for what I would do for my family is what I would do for these children. And that's just the way that I lead. And if you've been here before, we have a nest because I was that mom that had gone to places to get diapers and wipes and stuff, and you can go get what you need and you don't have to ask us. Providing things like that make families know that they're cared for opens up the door for the real stuff that we need to work through. So there are lots of micro things that we're doing to help families every day, and just be good humans and make good connections. And I think, I don't know, should we be passing around kindness like Mr. Rogers? I don't know,
In the early care and education field, there's a significant emphasis on quality improvement with teachers through various training models, and a lot of emphasis on how to handle children's challenging behaviors and this and such, and a lot less available trainings on how to engage families and how to support families. And so, I think those types of efforts are some low-hanging fruit that would be really beneficial, and a place where the agencies could come together to co-collaborate and build the type of training and information. And I think that goes some distance towards building trust and understanding about supporting rather than hotlining as a goal. So that, so that's one way to think about making a nice marginal incremental change, but yeah.
So if we had a magic wand where we could wave it and then implement some sort of new policy that would address a lot of the issues around here, what would that look like from each of your perspectives?
I think that if I had a magic wand, I think I'd love to be able to read the minds of the people who were with the children that were having the struggle, so I could know whether or not it was neglect or whether it was poverty. But I think that if we could wave a magic wand and have everybody take on the American legal maxim, I'm a lawyer after all, that you're innocent, you're presumed innocent that your circumstances are not, we're not going to presume that you're a bad person because you had your problem, and that we would not be punishing people for not calling a hotline or threatening to punish them. And instead, we would have a culture where everybody calls somebody to help, and that the hotline would be reserved for crimes, and you'd get somebody immediately. If I could, if we could wave a magic wand and provide those resources that to do that, and have resources we could actually get people to, that would change everything, and a lot of kids and a lot of families would be in a better place.
Yeah, Catherine, I think it goes a lot to just the perception of poverty and whether it's the individuals, if it's their fault that they're living in poverty, or whether it is the systems that are holding them in poverty. And the first perception of it being the individual's responsibility or their fault that they are impoverished is what leads to this perception of poverty as neglect. Have you looked at that at all at your institute?
I have many collaborators, friends, other researchers at IRP that have looked at this in the context of the child welfare system, as well. So Lonnie Berger, Kristen Shook-Slack, Jessica Pack, folks like that. I mean, and I think the short answer is people are poor because they have jobs that pay them too little, or they're unable to work full time because their capacities don't line up with what's rewarded in the labor market. I mean, the short answer is simply that we rely on people to work for money, and then many people are not paid living wages. I mean, that's why people are poor. It's not more complicated than that. And so, at the end of the day, there's that's not the way we conceptualize it, and certainly not the way, middle class and upper class people who believe they deserve all the money that they've earned, and that it's, a unique skill that they have that's been able to earn them that. That said, I think I'm just going to say something that's not useful for policy, but I think is really important, is that our communities have become more unequal. There's greater inequality. There's been greater economic segregation. And so in our communities, it is less and less likely that wealthy people come into contact with people who are low income and get to know them, to Alicia's sort of, be human and have human connection. And I think that perpetuates the misconceptions that people have about low income people, because they don't actually see, interact, and get to know them. And that is, that's problematic from a social fabric of our country sort of perspective. But I just always tell people, at the end of the day, our country requires people to work for money, and those that are not paid enough are, and that's the system, that's the labor market system that relies on low wage workers to extract, profit for companies. It's our setup in the labor market. It's not.
If I could add to that, Catherine, I think you're absolutely right, that because we don't have those connections with. I'm a guy who, when I grew up, I was a kid. We had some financial issues, and my mother had some mental health issues, and so I knew some of the stuff. Right, I can empathize. I can get it. I can understand. And when we run into trouble is when somebody thinks, well, I'm of a different class and I'm in a different place, and I, like you said, I deserve my money because I worked hard for it and all this sort of thing. They don't understand. A lot of people didn't have any opportunity to get anywhere near where they are, and so you don't think it could happen to you. And if you don't think it could happen to you, and that is something I think we've got to really change with people, to understand things could happen to anybody. Anybody could face poverty or addiction or mental illness, and it could spiral out of control and wind you up in the places where we find these people and judge them. And we've got to stop that, and then instead say, how can we come alongside them and lift them up and find and help them marshal their strengths?
And I completely agree with that. And also, most poor families have a full-time worker working full-time. Right. And the reason they're poor is because they are not paid enough. They're not paid enough money. And then when you're not paid enough money, it's hard to afford childcare, and it's hard to afford all of the, housing stability. Rent has we all know we have a housing crisis. Like, how are people earning $35,000, 2-3 kids, supposed to be able to keep an apartment or own a home? It's not economically possible.
We only have a couple minutes left, and I want to give Alicia the opportunity to offer closing thoughts before we wrap up.
Okay, so I have been paying attention to the chat. I love human connection, but so there was someone who was asking how, how do we, lean into human connection, but we also support workers in maintaining boundaries and avoiding burnout. I would suggest that everybody get this book. It's called All About Love by Bell Hooks. Really love it. And it costs you, it I think that we've gotten away from simple grace and mercy. We can have lots of conversation about that, but Gary knows we can talk policy and all this, and I still have very much my roots and my soul are entrenched in community and love. And when I've been harmful to myself or to community, folks snatch me back and remind me that I can get up again and that I can keep trying and I can keep going. And no matter how much money you have or how little you have, you need human connection, right? And so the disconnect between people causes our systems and everything to be broken, and we can go all around it. But as far as teachers in this space, if we are not connected to families, it's more stressful, because when you know what's going on with the family and what they need, no matter what their background, then you can be more empathetic, which causes you to have a different response, right? And so it's not as stressful when you know this child is acting out because dad just went off to prison. So then you have the community who's now supporting not just the child and the parent, but the teacher, right? We're checking in on that teacher. We're letting them have mental health walks. You can call us and cry and say, I'm having a mental health day. You get 3 of those years. It's not a lot, but that's on top of vacation that you don't have to tell us why you're coming to work. This is not easy work, but it is everything we deserve, and it is very possible. So that's all I got, Carrie. I don't have any,
You're kidding that the work that everyone here is doing is because these families deserve it. They deserve our work and our effort and the best lives that they can possibly live for themselves and their kids and their kids' kids. So I just want to thank you so much for sharing your time and expertise. Thank you, Darrell and Catherine and Alicia. What a robust, amazing conversation this has been. As you saw, the chat was just lighting up, and we had a lot of folks here. We will be posting this to YouTube so that if you want to watch this or share this with either service providers, or if you're in the academy, you want to show it to your classes, it's all going to be available. And keep your eye on your inbox. We are putting together a brief that's going to be based on a lot of the conversation that we've had here today. We will share that out with you as soon as it's ready. So thank you again on behalf of the Brown School and Open Classroom and the American Academy of Social Work and Social Welfare and all of our co-sponsors. Enjoy the rest of your day and have a wonderful weekend. Thank you all so much. Take care now.